Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we are going to discuss about the top 5 considerations before going for a hair transplant surgery. First off, it will be good to self-appraise your own degree of hair loss. So grab a mirror and look at which areas of scalp are visible under harsh lighting, and you know how thin your hair is getting. And sometimes thinning of the hair can be treated without hair transplant surgery, and this should be discussed with your hair restoration practitioner, especially if you're very young. A stitch in time really saves line when you're able to use certain medications, regenerative therapies, or using them in combination or adding on low-level laser light as alternatives to hair transplant surgery. Rushing into a hair transplant surgery without considering these other additional methods of treatment can be a recipe for disaster. Secondly, do your research on different techniques of hair transplantation. There are 2 main techniques that are now widely available, which are the linear strip excision technique, where a strip of scalp is cut out from the donor area or the back of the scalp. And there's also the FUEE, or the follicular unit extraction and excision technique, which involves a larger area of shaving and individually extracting follicular units for transplantation. And each of these techniques have their own benefits and downsides. And doing your research into them, like looking at our website, which discusses in detail which surgery would suit which patient characteristic better, will be a good starting point. If you'd like to know more about the differences between linear strip excision and follicular unit excision surgery, I'll leave the link in the video description box below. Truth be told, and this is an important third point, not everybody is suitable for hair transplant surgery. Many factors actually have to be taken into consideration, such as your age, the degree of hair loss, a family history of genetic balding, whether or not you can take medications to protect the rest of your hair, what are your expectations out of the surgery, whether your donor area is sufficient, should all be taken into consideration before recommending any kind of hair restoration surgery to you. And this should be discussed at length with your hair restoration practitioner, and understanding the expected outcome before recommending a surgery is very important. To elaborate more on this, it is important to understand that there is a limit to what surgery can achieve, and it's important to set a realistic goal in discussion with your physician about what outcomes can be achieved from one surgery, for example. What will the donor area and the recipient area look like after this surgery? A lot of factors are going to be discussed during the consultation, such as where the hairline is going to be placed, what density of implantation is going to be at various areas of the scalp in order to achieve a natural and aesthetic outcome from the surgery. Cost and budget are also a very important point to consider when it comes to planning for your hair transplant surgery. And we do see patients go for really cheap black market options, 50 cents or $1 per graft. And these are usually done by untrained technicians in some obscure parts of the world. And I would strongly encourage that you seek somebody with medical credentials and hair restoration training to carry out your procedure so that you have the best chance of success. And hair transplants can be expensive. It's important that you know what the total cost of the surgery is, including any surprise hidden costs. Find a clinic that's transparent fully with their costs so that you're not hit by a large surprise price tag after the surgery. Point number 5, and lastly, but also very importantly, people tend to think of hair transplant surgery as the one and only fix-all solution to their hair loss woes. It is not the case. There is going to be some long-term maintenance that will be prescribed to you in most situations, and some surgeons even refuse to do surgery if patients do not take their long-term maintenance protocols strictly. That all also factors into long-term cost as well, because each pill that you're prescribed costs some money, and you're going to be using this for extended periods of time, 10 years, 15 years, in order to maintain the results and to protect the rest of the native hair. It is also important to consider whether or not these long-term treatments are suitable for you, given that they may result in side effects even though the risk is low. whether or not taking medication is something that is compatible with your job, such as if you are going to be an athlete or if you're flying an aircraft, and will these affect you in any significant way, should be discussed at length with your physician, because once you've committed to a long-term treatment protocol, usually the plan is to stick to it. And there you have it, the top 5 considerations before you actually go for your hair transplant procedure. It's also good to research these in detail before even making an inquiry with your preferred practitioner. If you've got any questions for us, please leave them in the comment section below. Don't forget to click like and subscribe for more content on hair loss related topics, and I'll see you next time.